Today, we are going to talk about a study which demonstrates the efficacy and safety of sustained release metoprolol with dronedarone after radiofrequency ablation of paroxysmal atrial fibrillation, and it is a propensity matched analysis. The highly early recurrence rate after radiofrequency catheter ablation seriously affects the prognosis of patients with atrial fibrillation, and there are still controversies regarding the best preventive drugs for postoperative recurrence. A single-center retrospective study was conducted on patients with paroxysmal atrial fibrillation who received metoprolol sustained-release tablets combined with dronedarone, that is observation group, and dronedarone alone, that is control group, after the first radiofrequency catheter ablation. A matching cohort was established using a 1:1 propensity score matching method to compare the incidence of early recurrence rate, cardiac function, inflammation level, quality of life, and antiarrhythmic drug related adverse reactions between groups. A total of 56 pairs of patients were successfully matched. The incidence of early recurrence rate in the observation group was significantly lower than that in the control group. The left atrial diameter in the observation group was significantly lower than that in the control group on day 90 after radiofrequency catheter ablation. And the quality of life of the observation group was significantly improved on the 30th and 90th days after radiofrequency catheter ablation compared with the control group. Multifactorial Cox analysis showed that diabetes mellitus, left atrial diameter greater than 45 mm, ventricular rate greater than 110 beats per minute, and postoperative antiarrhythmic drugs were independent risk factors for early recurrence rate in patients with paroxysmal atrial fibrillation. The incidence of sinus bradycardia in the observation group was significantly higher than that in the control group, but there was no statistical difference in the overall incidence of antiarrhythmic drugs related adverse reactions between groups. Compared with dronedarone alone, dronedarone combined with metoprolol sustained release tablets can significantly reduce early recurrence rate after radiofrequency catheter ablation in patients with paroxysmal atrial fibrillation and improve cardiac function and quality of life without increasing the antiarrhythmic drug related adverse reactions.